Good evening. As health authorities predicted, Sydney's COVID crisis has taken another turn for the worse, and it could mean tougher restrictions. The number of new cases has skyrocketed to 97, taking the total number since the outbreak began to more than 1,000. But the biggest concern is that the number of people infectious in the community is also rising. The latest figure, 46. On the positive side, though, there's been a big jump in testing, with 77,500 carried out. And police are warning of a major crackdown to stop people trying to sneak out of Sydney for the regions this weekend.
The impact of the virus inside the healthcare system is worsening, heaping pressure on a workforce already going above and beyond.
When we have a healthcare worker exposure and an infectious healthcare worker, we obviously take a very precautionary approach.
At Liverpool Hospital, more than 60 people are isolating after a patient tested positive on Wednesday. Now, a visiting doctor also has the virus, sending a further 39 staff and 7 patients into ISO for a fortnight. That doctor also worked at Campbelltown Hospital, where 58 staff and 5 more patients are now close contacts. Non-urgent surgery has been postponed at both hospitals. The Liverpool ambulance station has also been deep cleaned after 3 confirmed cases in the southwest workforce. Contact tracers are reviewing dozens of potential exposures.
And they deal with the sickest of the sick, so it is really a heightened stress that paramedics carry every day.
At Westmead Hospital, a dispute over protective equipment has been resolved. More than 200 cleaners had refused to enter the COVID-19 ward, claiming they couldn't get proper foot coverings, hairnets and fitted masks.
These are fundamental things to care for people that weren't being done.
Whatever they want, they will have.
Well, it shouldn't have to take a minister to intervene simply for frontline workers to get the protective equipment needed to keep themselves safe.
It's exactly 1 month since the first case was reported in what health officials call the Bondi cluster. Despite the name, the greatest spread is now in the southwest. The number of cases in this outbreak today moving above 1,000. Across the state, there were 77,000 tests yesterday, diagnosing 97 cases to 8 p.m. 46 of them were infectious in the community for at least part of the time.
This is the number that is concerning. That number of people being infectious in the community keeps going up.
The Australian Medical Association believes it's time for tighter restrictions.
Right now, if we keep going the way we are, New South Wales is looking at a lockdown Sydney for weeks, if not months.
The state government is considering targeted local measures for areas of concern.
If we need to go harder, of course we will.
75 people are in hospital, 18 in intensive care, 5 of them are on ventilators. With no guarantee when the lockdown will lift, there's a question mark over state parliament due to sit the first week of August. Kiama MP Gareth Ward has asked the Speaker to move it online.
I know that a lot of regional members in particular are very anxious about coming to Sydney and potentially bringing COVID back to their communities. When the technology exists, why wouldn't you use it?
Speaker O'Dea has replied, saying he essentially agrees and has been pushing for virtual proceedings. But he also added, "I encourage you to raise your view with the Premier's office, which has previously resisted the suggestion."
I haven't had any specific proposals put to me about Parliament, and to be honest, that's the least of our worries at this point in time.
Well, Lachlan joins me now at the desk, and Lockie, for a change, you've got some good news to share.
We need some good news, Sandra. This is a great one too. There is a big collective sigh of relief after a cleaner tested positive at the Minchinbury Manor Aged Care Home in Rooty Hill. Now, yesterday, all other residents and staff were tested. The great news, all 187 swabs have returned negative for COVID. The site will remain locked down, though. More than 90% of the staff and residents there have been vaccinated. A mobile clinic will now be offering jabs to everyone else, Sandra.
It is good news. All right. Thanks, Lachlan.